Blackpool Teaching Hospitals NHS Foundation Trust, our strategy 2022 to 2027. Welcome to our overview of the new 5-year strategy for Blackpool Teaching Hospitals NHS Foundation Trust. And thanks for taking the time to read our plans and ambitions which set out what we'll do between now and 2027. The plan has been developed over a number of months, taking into account feedback we already had about our services and including ideas, suggestions and priorities from the NHS nationally and regionally, as well as colleagues across the organisation and wider health and social care system in Blackpool, Fylde and Wyre. In bringing it together, we've also, most importantly, linked in with local people, partners and especially patients and their families to understand what they think and need us to do differently. This document sets out the plan to deliver those improvements, and we need everyone in Blackpool Teaching Hospitals and the community to be part of it. The team is up to the challenge. You only have to consider their hard work and dedication throughout the pandemic to know this. We're incredibly grateful for everything everyone has done across all hospital and community settings, and not least in people's homes. We're going to need to work together with local people, partners and the wider health and social care system too. But again, we have strong relationships already in place from supporting each other through COVID. It's been the most challenging of times, but the strength, support and solidarity across Blackpool, Fylde and Wyre has been incredible and will provide us with the energy and determination to continue. And so, over the next 5 years, we'll focus on making improvements that really matter and make a difference to everyone. Staff who feel supported and valued always provide the best care and experience for patients and their families. So it's important we make our organisation a place where everybody wants to be, whether that's opportunities for local people to work and develop their careers with Blackpool Teaching Hospitals, ensuring those already with us want to stay, or attracting new skilled colleagues to relocate into the organisation. Having the right people is going to be key. It's important when making plans to also remember that we live and work in one of the most popular tourist destinations in the country. It's both amazing and sobering to note just how many visitors come to the Fylde coast, not just during the summer months but all year round to explore our local landscapes and beaches, legendary hospitality and bustling nightlife. This is focused, of course, on the famous seaside resort of Blackpool, with its heritage and tourist attractions. It's an important part of who we are and also the foundation of our economy. But it adds demand into services that need to be provided without affecting local people and their needs. Most importantly, we need to make sure communities have what they need and experience the very best healthcare equally. Whilst the area has some of the most affluent and sought-after postcodes in Lancashire, we also have some of the UK's most deprived neighbourhoods, where people struggle with poverty, reduced opportunities, poor health, and can often die earlier than they should. This 5-year plan sets out how we'll prioritise and tackle this, promoting equal access to support and services, as well as being clear that we have to work with other organisations and local people to develop and provide the very best healthcare for everyone. We know it's not always easy to find a service or understand how it all works, and we need to improve this with everyone involved. This might sound simple, but getting the basics right is the first thing we need to do. This means providing good services, recruiting and retaining good people, and making sure that when things are not right, then we welcome the feedback and sort it out. Please do read this overview, and if it inspires you, please get involved. There are lots of ways to do this, and we need as many people to help as possible. Know also that whilst this plan provides a way forward to 2027, it will change along the way, bending to new ideas, taking on suggestions, recognising things that have worked in other places, and of course reacting to unknown challenges that might come along, such as the global pandemic. There's lots to do, but together we can achieve this and improve lives, and that's the very reason we're here. Our vision is to improve the lives of people who live, work and volunteer on the Fylde coast and beyond. In January 2022, we invited staff, patients, carers, the local community and key partners to be involved in the development of our 2022-2027 strategy. Following these engagement exercises, we've developed the strategy to clearly indicate our vision, to improve the lives of people who live, work and volunteer on the Fylde coast and beyond. The approach we took to do this was key and shows that we are committed to listening to our staff and actively engaging patients in how we deliver safe, effective, sustainable care for everyone, every day. Together, our engagement community told us what's important to them: being an employer of choice, recruiting and retaining staff, especially from local areas, growing excellence through training, education, research and innovation, health promotion and prevention, improving our impact on the environment, creating safe, healthy environments to work and receive care in. We invited staff and patients to attend virtual workshops led by our Chief Executive, Trish Armstrong-Child. We encouraged all staff to participate in an online survey promoted on Trust social media channels. We engaged with groups of children and young people to understand what the strategy means to them. Feedback received from engagement sessions. A patient said, "I thought that with the time allotted and contributors being unknown, it was planned and operated effectively and efficiently." To have the Trust CEO introduce and summarise the session was, I thought, an excellent indicator of commitment from the top to engage with individuals and representatives from the community. Plus, time was provided for individuals to have their say, and they received full and meaningful responses. A colleague said, "Really good session. Great to hear that people are listening and want staff involvement and opinions, plus the same from patients." A key partner said, "These revisions make the strategy more complete and easier to understand for people across a wider range of backgrounds. Great progress." Children and young people. We reached out to our education partners, schools and voluntary sector groups to understand what is important to children and young people. Key themes included child-friendly facilities, for example, more toys and games available, digital tools including access to items such as chargers, gaming consoles and electronic food ordering, improving communication with children and young people to let them know what's happening, improved selection and quality of food, shorter waiting times for treatments, tests at community facilities, calmer waiting areas, careers guidance and information from Year 8 onwards, more flexible options for accessing healthcare, including off-site facilities, drop-in opportunities and access to information in ways other than face-to-face. Summary of our strategy. Why are we here? Our mission is to deliver safe, effective, sustainable care for everyone, every day. What do we want to achieve? Our vision is that we will improve the lives of people who live, work and volunteer on the Fylde Coast and beyond. How will we achieve this? Our aims are our people will widen access to job opportunities, becoming the employer of choice within our community with an empowered, diverse and engaged workforce. Our population will work with our population to co-produce high-quality services with a key focus on preventative care and reducing health inequalities. Our responsibility will work with partners to deliver high-quality, financially sustainable services and reduce our environmental impact. What's important to us? Our priorities for our people are: grow our own, happy and healthy workforce, learning culture. Priorities for our population are integrated care, health inequalities, prevention and health promotion. Priorities for our responsibility are: get the basics right, new ways of working, investing in our community. Summary of our priorities, our people. We'll widen access to job opportunities, becoming the employer of choice within our community with an empowered, diverse and engaged workforce by growing our own. We'll maximise the benefit of our diverse local community to grow our own future workforce and create local health and wealth. A happy and healthy workforce. We'll care for our people and support them in maintaining resilience and well-being. We understand that the capacity to care for our patients is reliant on our staff well-being. A learning culture. We'll engage and empower staff in their education and learning, encouraging the development of psychological safety and constructive challenge to improve patient and staff experience. Our population. We'll work with our population to co-produce high-quality services with a key focus on preventative care and reducing health inequalities by focusing on health inequalities. We'll address inequalities in access, experience and outcomes of our care. Integrated care. We'll continue our commitment to co-produce integrated care, working with health and social care partners and patients to influence neighbourhood plans. Prevention and health promotion. We'll prioritise prevention and early detection of illness in disadvantaged groups. We'll also support patients in developing the skills, confidence and knowledge to manage their own health. Our responsibility. We'll work with partners to deliver high-quality, financially sustainable services and reduce our environmental impact by getting the basics right. We'll work collaboratively with our partners to improve quality of care and become a Care Quality Commission, CQC, good rated organisation. New ways of working. We'll use transformation, digital, innovation and research to deliver new efficient models of care to widen access, enhance health promotion and improve our environmental impact. Investing in our community. We'll work collaboratively with our partners and communities to positively impact beyond healthcare. Summary of our objectives. Our people objectives. To grow our own, we'll seek opportunities to widen access to jobs for future generations, develop attractive, innovative roles to reflect skills available, and opportunities to recruit. Create opportunities to develop, train and retain our staff. For a happy and healthy workforce, we'll ensure all staff are treated equally with respect and have access to the same opportunities. Develop a health and well-being culture. #TeamBTH. To develop a learning culture, we'll encourage an environment to enable continuous improvement. Create a culture that facilitates freedom to speak up and listening into action. Build leadership through development. Our population objectives. In relation to health inequalities, we'll embed equity into our delivery plans, seek insights into health inequalities, build understanding of health inequalities. For integrated care, we'll co-produce service improvements and redesign to improve access and timelines of care. Deliver as a system partner. Enhance and integrate community services to support the right care at the right place at the right time. To support prevention and health promotion, we'll make every contact count, MECC. Actively support patients to improve health outcomes and reduce health inequalities. Our responsibility objectives. To get the basics right, we'll strategically align the organisation, achieve quality standards and accreditations, deliver the financial viability programme. For new ways of working, we'll enhance our digital and data infrastructure, transform and innovate, maximise the efficient use of estates, enhance active participation in research. To continue investing in our community, we'll deliver our Green Plan priorities, co-design a local community anchor framework focused on the well-being of our population. About us. Blackpool Teaching Hospitals NHS Foundation Trust is situated on the west coast of Lancashire, with services covering the local authority areas of Blackpool, Fylde and Wyre. The Trust is part of the Lancashire and South Cumbria Integrated Care System, ICS, supporting a population of around 1.6 million people. We have 3 main hospitals providing acute services to around 330,000 local residents. The organisation also provides specialist tertiary care for cardiac and haematology services, delivers community health services to over 445,000 residents, including those in North Lancashire, and hosts the National Artificial Eye Service across England. Plus, we provide urgent and emergency care services to an estimated 18 million people who visit the seaside resort each year. Our sites include Blackpool Victoria Hospital, Clifton Hospital, Fleetwood Hospital, Whitegate Health Centre, Lytham Road Primary Care Centre, South Shore Primary Care Centre, Fleetwood Primary Care Centre, Moore Park Health and Leisure Centre, National Artificial Eye Service. Atlas. We host a subsidiary company, Atlas, that provides estate services and management across the Fylde coast. Blue Skies. We are the corporate trustee for the Blue Skies charity, supporting the best in patient care and medical research for the Blackpool, Fylde and Wyre area. Annual statistics. As a regional centre and key tourist hotspot, we provide care to a significant number of people, both from within and outside of our local area. 75,000 people seen in A&E, 2,900 urgent care visits, 118,000 walk-in attendances, 800 beds across Blackpool Victoria and Clifton Community Hospitals, 7,521 staff, 68 nationalities, 400,000 outpatients supported, 5,000 elective inpatients, 50,000 day cases, 50,000 emergency inpatients, 1.6 million population across Lancashire and South Cumbria, 354,000 GP registered Fylde Coast health and care population, 580 million annual turnover. Our population, Demographic data highlights the relatively older age of the population, with more than a quarter of the population in Fylde and Wyre aged over 65. This creates pressure for health services and will continue to do so in the future as the population ages. Approximately 330,000 people live in the Fylde coast area. A quarter of the population in Fylde and Wyre are aged 65 plus. By 2027, the population in Blackpool aged over 65 will exceed those aged 0 to 15 years. Furthermore, the population aged over 65 in Fylde and Wyre will be more than double that aged 0 to 15 years by 2027. Data also shows that there's little ethnic diversity across the Fylde coast. 97.4% of the population were recorded as white British at the last census, compared with 85.9% nationally. Our key challenges: health inequalities. The Fylde coast is an area of contrast. There are high levels of deprivation in Blackpool, which experiences the greatest deprivation of all in England's local authorities, and there are similar pockets of deprivation in Wyre, particularly in Fleetwood. However, there are affluent areas in Wyre, and generally, Fylde is less deprived than other parts of the country. Deprivation reduces life chances and leads to poor health outcomes. We also know that inequalities that can lead to deprivation begin from the start of life. In Blackpool, 21% of pregnant women smoke at the time of delivery, and 13.3% in Fylde and Wyre, compared to 9.6% nationally. Babies born in Blackpool have the lowest life expectancy in England, and in Wyre the life expectancy is also below the national average, whilst in Fylde it's the national average. Plus, a quarter of children in Blackpool live in low-income families, which means that 1,500 more children are living in relative poverty than in areas of the national average of low-income families. A lower proportion of children in Fylde and Wyre live in low-income families, but figures are still 14.4% and 17.1% respectively. These patterns of inequality continue through life, with lower than national rates of educational attainment in Blackpool, but similar or better rates in Fylde and Wyre. People who have good social links and connections are less likely to become ill and more able to recover if they are ill. However, 29.3% of adults experience loneliness in Blackpool, compared to 22.3% nationally. Again, it's a mixed picture, as rates of loneliness are lower in Wyre, 23.5%, and particularly low in Fylde, 16.9%. Deprivation is linked to poor health behaviour and rates of obesity. Smoking and alcohol consumption are high in Blackpool. In addition, people in these communities may find it more difficult to access health services, and this is shown in lower rates of screening and lower rates of early cancer diagnoses. Rates of obesity, smoking and alcohol consumption in Fylde and Wyre are similar to the England average, but rates of screening are low in both, and the rate of early cancer detections is low in Wyre. Finally, inequalities can be seen in mortality rates. Rates of early death from preventable causes such as cancers, respiratory and cardiovascular disease and alcohol and drug-related deaths are higher than national rates in Blackpool and Wyre. However, there are affluent areas in Wyre, and generally, Fylde is less deprived than other parts of the country. Financial challenges. In 2021-2022, the operating income and expenditure is around 580 million, which means the Trust is forecasting financial break-even. Budget setting for 2022-2023 is in progress, and discussions with the ICS and partners continue to establish the level of resources required to deliver a balanced financial plan. But the estimated spend is similar to 2021-2022. An indicative cost savings target of 21 million has been set. This figure may change if the investment needed to meet patient demand and reduce the elective waiting list increases. Delivery of the financial plan will ensure the Trust maintains a healthy cash balance and can continue the planned capital investment of £34 million. But this is dependent on the Trust receiving the level of resources needed to support the proposed investment. This figure has been supported by one-off extraordinary funding, which will reduce over time. It's expected that cost savings around 3% to 5% will be required to bring the organisation back into financial balance, and it's vital that we deliver a position of break-even or better. Delivery of the financial plan will not require any further working capital loans and will allow the organisation to continue to invest in capital developments. The demand for services and how they're delivered by the organisation and its partners will impact on financial performance and our ability to save money and invest in services. It's important that we deliver services as efficiently and effectively as possible, reducing waste and removing duplication. Quality and safety challenges. In 2019, the organisation was placed in challenge provider status by the regulator due to safety concerns regarding mortality, staffing and patient access targets. Since then, we've been working closely with the regulator to carry out key actions for improvement. In July 2021, following the new NHS England and Improvement System Oversight Framework, the organisation was rated as System Oversight Framework SOF Level 3 against 5 key themes. 1. Quality of care, access and outcomes. 2. People. 3. Preventing ill health and reducing inequalities. 4. Leadership and capability. 5. Finance and use of resources. 6. Local strategic priorities. SOF Level 3 identifies us as having significant support needs against one or more of the 5 national oversight themes and in actual or suspected breach of the Foundation Trust licence. In December 2021, Blackpool Teaching Hospitals received an overall CQC rating of Requires Improvement. Since being placed in challenge provider status, we've made significant improvements against key areas, including mortality. However, we do recognise that more work needs to be done. Our 5-year strategy focuses on partnership working and co-production of high-quality services, whilst recognising that empowering staff is key to continuous improvement. Facts and figures. Male life expectancy at birth in Blackpool was 74.1, in Fylde 79.9 and in Wyre 77.8, compared to an England national average of 79.4. Female life expectancy at birth in Blackpool is 79.0, in Fylde is 82.9 and in Wyre 82.3, compared to an England national average of 83.1. Children in relative low income families percentage in Blackpool is 24.9, in Fylde is 14.4 and in Wyre is 17.1, compared to an England national average of 19.1. Adult loneliness percentage in Blackpool is 29.3, in Fylde is 16.9 and in Wyre is 23.5, compared to an England national average of 22.3. Under 18 conceptions rate per 1,000 in Blackpool is 31.1, in Fylde is 12.0 and in Wyre is 18.7, compared to an England national average of 15.7. Smoking status at delivery percentage in Blackpool is 21.4, in Fylde is 13.3 and in Wyre is 13.3, compared to an England national average of 9.6. Prevalence of overweight and obesity, Year 6, percentage in Blackpool is 41.5, in Fylde is 29.7, compared to an England national average of 35.2. Data for Wyre was unavailable. Excess weight in adults percentage in Blackpool is 71.6, in Fylde is 66.9 and in Wyre is 62.7, compared to an England national average of 62.8. Physically active adults percentage in Blackpool is 62.0, in Fylde is 68.9 and in Wyre is 62.9, compared to an England national average of 66.4. Smoking prevalence in adults percentage in Blackpool is 19.8, in Fylde is 5.5 and in Wyre is 7.3, compared to an England national average of 12.1. Alcohol-related harm in under 18s rate per 100,000 population in Blackpool is 722, in Fylde is 493 and in Wyre is 521, compared to an England national average of 456. Estimated diabetes diagnosis rate percentage in Blackpool is 79.4, in Fylde is 67.4 and in Wyre is 74.2, compared to an England national average of 78. Early cancer diagnosis rate percentage in Blackpool is 49.0, in Fylde is 54.5 and in Wyre is 51.1, compared to an England national average of 55.1. Bowel cancer screening coverage percentage in Blackpool is 53.7, in Fylde is 63.6 and in Wyre is 63.5, compared to an England national average of 65.2. Infant mortality rate per 1,000 in Blackpool is 5.4, in Fylde is 2.3, and in Wyre is 3.3, compared to an England national average of 3.9. Under 75 mortality from preventable causes rate per 100,000 population in Blackpool is 265.2, in Fylde is 135.5, and in Wyre is 164.8, compared to an England national average of 142.2. Hip fractures in people aged 65 plus rate per 100,000 population in Blackpool is 588, in Fylde is 548, and in Wyre is 520, compared to an England national average of 529. Key investments. Over the last 5 years, the organisation has invested around £112 million into capital developments, which include buildings, equipment and IT. This has been funded by Blackpool Teaching Hospitals and the Department of Health and Social Care. The investment has enabled us to maintain services and enhance the delivery of high-quality care. Examples of key investments we've made include endoscope decontamination development, clinical utilisation reporting system, obstetric theatre development, redesign A&E, Vanguard Care Home Connect, wireless network infrastructure, beds, cardiac Drager monitoring, IMS Maxims, electronic patient management EPMA, cardiac heart-lung machines, theatre equipment, MRI machines, endoscopy development, cardiac catheter laboratory, emergency village, modular ward, digitisation, scanning. The changing NHS landscape. Blackpool Teaching Hospitals NHS Foundation Trust plays a key role as part of the Lancashire and South Cumbria Integrated Care System, ICS. Lancashire and South Cumbria provide a collaborative board, PCB, and Fylde Coast Place-Based Partnership, PBP. Strategic context. Across England, 42 integrated care systems have been established with the aim of achieving integration across health and care services to improve population health, reduce health inequalities, support productivity and sustainability of services, and to support social and economic developments. In February 2021, the Department of Health and Social Care put forward legislative changes to the Health and Social Care Bill that will result in integrated care systems being statutory bodies from July 2022. The bill sets out the new functions and responsibilities of the Integrated Care System, ICS, including the ability to delegate to place-based partnerships, PBPs, and provider collaborative boards, PCBs. In response to the establishment of new statutory bodies, NHS England and NHS Improvement have introduced a new NHS System Oversight Framework 2021 to 2022 for systems and NHS trusts. This means that over the next 5 years we'll need to think differently about how we deliver care for our local population. Our vision is to improve the lives of people who live, work and volunteer on the Fylde Coast and beyond. Aligns with these key strategic documents. Our 5-year strategy has been developed in the context of national and local strategies and the changing NHS landscape. We expect our strategy to be flexible to respond, change and reprioritise when needed. We'll review and refresh our strategy annually, or sooner when needed. Key national and local strategies. The NHS Long-Term Plan, LTP. Released in January 2019, this sets out the national priorities for the NHS over the next 10 years. Lancashire and South Cumbria Integrated Care System, ICS strategy. Released in January 2020, this outlines how partners across the ICS will work together and deliver a new way of working to achieve the vision of healthy local communities, where people have the best start in life so they can live and age well. Fylde Coast Integrated Care Partnership, now Place-Based Partnership, PBP. Released in August 2020, this looks at the challenges we're facing across the Fylde Coast and how we'll tackle them together so people will have longer, healthier lives. Blackpool Town Prospectus 2030 Agenda for Action. Published in October 2018, this outlines plans to build 3,000 new homes, improve employment rates for 16 to 25-year-olds through a focus on health and well-being, and boost national perceptions of the resort as somewhere to invest and build businesses. Blackpool Council Plan 2019 to 2024. The vision for Blackpool Council is to be the UK's #1 family resort, with a thriving economy that supports a happy and healthy community who are proud of this unique town. The Council have set out 2 key priorities, which are to maximise growth and opportunity in the Blackpool economy and create stronger communities, increasing resilience. The Council plan sets out how they'll deliver this. Underpinning strategies. We've developed 3 key strategic aims to support the delivery of our vision. We'll improve the lives of people who live, work and volunteer on the Fylde coast and beyond. A number of other strategies already exist nationally and locally. It's important that our strategy aligns with these whilst also meeting our local priorities. Our people will widen access to job opportunities, becoming the employer of choice within our community, with an empowered, diverse and engaged workforce. Underpinned by the NHS People Plan 2020, Trust Quality Improvement Strategy 2019, NHS Model Employer Strategy 2019. Our population. We'll work with our population to co-produce high-quality services, with a key focus on preventative care and reducing health inequalities. Underpinned by the NHS Patient Safety Strategy 2019, NHS Long-Term Plan 2019, NHS Food Standards 2014, Integration and Innovation, working together to improve health and social care for all, 2021. Our responsibility. We'll work with partners to deliver high-quality, financially sustainable services and reduce our environmental impact. Underpinned by Health Infrastructure Plan 2019, delivering a Net Zero National Health Service 2020, Lancashire and South Cumbria ICS Strategy 2020, Fylde Coast ICP Strategy 2020, NHS e-Procurement Strategy, Data Protection Act, a Communications Strategy and Implementation Plan 2018, Prevent Strategy 2011, Counter-Terrorism and Security Act 2015. Our people priorities. Priority 1, grow our own. Maximise the benefit of our diverse local community to grow our own workforce and create local health and wealth. Seek opportunities to widen access to jobs for future generations. Blackpool is ranked 313 out of 324 local authority areas for social mobility. This means that young people living in deprived areas may miss out on the same opportunities offered in wealthier locations. The UK government identified Blackpool as an opportunity area to focus on providing every child and young person in the area with a chance to reach their full potential. To benefit from our diverse local community, we need to improve awareness of the wide range of career opportunities we have to offer. Children and young people who engaged in our strategy development said that from year 8 they'd like to have annual career conversations about future healthcare opportunities. Ensure that staff and school leavers are aware of the variety of career opportunities in the NHS and the career progression we offer. Develop entry-level opportunities and career pathways in all areas of the organisation, from the staff restaurant to facilities and estates. Develop attractive, innovative roles that reflect skills available and opportunities to recruit. As a coastal community, Blackpool is challenged with recruiting and retaining health and social care staff. The Chief Medical Officer's Annual Report 2021 shows that coastal communities like the Fylde Coast have 14.6% fewer postgraduate medical trainees, 15% fewer consultants, and 7.4% fewer nurses per patient. To address this, we need to provide incentives for qualified workers to come and work for our organisation. Develop new ways of working to fill existing vacancies through skill reviews, new models of care, and by making entry requirements more flexible. Creating opportunities to develop, train and retain our staff. We recognise that to grow and develop our staff, we need to help them develop the key skills needed and to provide opportunities to fulfil their potential. To do this, we need to develop career pathways and opportunities from beginner to expert level across all clinical and non-clinical specialities. Develop a talent and succession planning programme to identify future leaders. Work with universities and higher education providers to deliver courses closer to the Fylde Coast area. We recognise that not all training opportunities to develop new skills are available locally. Staff will often hope to move areas where they can train and develop their skills. We'll identify opportunities to deliver training and education closer to encourage trainees to establish roots on the Fylde Coast. By working with local providers, we'll be able to understand what opportunities are available. Importantly, we also need to make sure our internal processes help and support staff to achieve their potential. We'll improve our appraisal systems, align them to the strategy, and introduce all new starters to our strategy, aims and priorities. Priority 2. Happy and healthy workforce. Care for our people and support them in maintaining resilience and well-being. We understand that the capacity to care for our patients is reliant on our staff well-being. Ensure all staff are treated equally, with respect, and have access to the same opportunities. The principles of equality and inclusion are at the heart of everything we do, and all that we stand for. We're committed to developing a workforce that's representative of the population we serve. Equality is about creating a fairer society where everyone has the opportunity to fulfill their potential. Diversity is about recognizing and valuing difference. Inclusion is about a person's experience within the workplace and in wider society, and how much they feel valued and included. We want to ensure that equality, diversity and inclusivity are considered in all our processes, procedures and interactions. Develop a health and well-being culture. Our health and well-being model is based on psychological pro-social behaviour. Pro-social is a term that describes an employee's helpful behaviour toward other people or the organisation. The behaviour is beneficial for the people or organisation it's directed at and can be measured to show organisational effectiveness. Pro-social psychology is a model we want to use to improve the health and well-being of our staff to develop a safe, effective and sustainable organisation for everyone, every day. We've introduced a health and well-being model that sets out what we'll focus on. Improving personal health and well-being, helping and encouraging our people to manage their own health and well-being. Relationships, focusing on the way our teams work together and support each other. Fulfillment at work, supporting growth and passion. Managers and leaders, developing healthy leadership behaviours and skilled managers. Environment, providing a safe place to rest, recover and succeed. Data insights, measuring how effective we are at improving health and well-being needs. Professional well-being support, designing appropriate support services for staff. Priority 3. Learning culture. Engage and empower staff in their education and learning, encouraging the development of psychological safety and constructive challenge to improve patient and staff experience. Encourage a learning environment to enable continuous improvement. In 2019, Blackpool Teaching Hospitals launched its quality improvement strategy that set out 3 key aims: to reduce avoidable harms, to improve mortality, to improve the last 1,000 days of life. These aims remain important to us as we build a culture of continuous improvement and support staff with developing the skills needed so that they feel empowered to make key changes to how patient care is delivered. As a teaching hospital, education is a priority to build the capability and skills in our workforce. To do this, we want to work with key staff groups to look at opportunities for entry-level placements and develop our existing workforce. Create a culture that facilitates freedom to speak up and listening into action. To improve our services for patients and ensure staff have a safe and effective working environment, it's important that they feel empowered to speak up about anything that gets in the way of doing a great job. To support this, we need to strengthen our freedom to speak up approach. The National Guardian's Office leads, supports and trains a network of Freedom to Speak Up Guardians, who were created as a result of the Francis Report, the Freedom to Speak Up 2015. This report suggested that NHS culture didn't always encourage or support workers to speak up. To become a learning organisation will empower our staff to speak up and have the right processes in place for us to listen and take action. Speaking up not only improves patient care and safety, but also helps to tackle bullying and discrimination, which is vital for the health and well-being of our workforce. In addition, we'll enable staff to have the confidence and skills to take ownership of concerns raised, respond appropriately and deliver continuous improvement. Build leadership through development. Our managers and leaders play a vital role in inspiring future generations, leading successful teams and improving organisational culture. In 2021, we changed our divisional structure and created new triumvirates, which bring together people with skills in the 3 areas of medical, nursing and operational leadership. We've also invested in corporate deputy roles and now need to invest in and develop these roles to improve operational performance, culture and patient outcomes. Our people success measures are: increase the number of staff at Blackpool Teaching Hospitals who live in the local area, build school leavers' awareness of career pathways in the NHS, increase staff retention rates to above the national average, improve staff engagement survey results, improve patient experience satisfaction levels, make good progress towards filling all our vacant positions, train all staff in quality improvement, achieve the workforce race equality standard. Our population priorities. Priority 4. Health inequalities. Address inequalities in access, experience and outcomes of our care. Embed equity into our delivery plans. Addressing health inequalities is key to our elective care delivery programme for surgical or medical treatment chosen by the patients that's not urgently necessary. We must ensure inclusive accessibility to care and will reduce inequalities experienced as a result of deprivation, disability or ethnicity. Nationally, to support the reduction of health inequalities, the Core 20+5 programme has been established. Local integrated care systems need to define a target population cohort, Core 20+, and target 5 focus clinical areas for rapid improvement. Ours are maternity, severe mental illness, chronic respiratory disease, early cancer diagnosis, hypertension. We'll work with our partners to deliver the Core 20+5 objectives. We'll also reduce health inequalities in the most deprived and excluded groups to tailor health services and improve access and outcomes to care. Seek insights into health inequalities. To build equality into our delivery plans, we need to make sure our services have access to health data. Over the next year, we'll develop ways to capture data and information on health inequalities to support action, measure improvement, and provide assurance across the organisation. Using this data, we'll be able to work with our partners to develop an approach to measuring the health of our population. The data will enable us to develop an understanding of health inequalities for our population, services and staff, and co-produce changes to improve health outcomes for all. Build understanding of health inequalities. To reduce health inequalities across our services, we'll provide our staff with the knowledge and tools to reduce health inequalities in their services. We'll offer training to all staff on health inequalities and the use of methods such as Health Equity Assessment Tool to enable them to identify health inequalities in clinical areas and patient access, experience and outcomes. Once we've developed data and insight and an increased understanding of our health inequalities, we'll co-produce improvement programs to address them. Priority 5. Integrated care. Continue our commitment to co-produce integrated care, working with health and social care partners and patients to influence neighbourhood plans. Co-produce service improvements and redesign to improve access and timelines to care. Across the organisation, we have examples of outstanding practice where staff and patients are actively engaged in service redesign and improvement. By developing a model of co-production, we'll provide staff and teams with the skills and knowledge to ensure patients, carers, volunteers, governors and the general public are active participants in care. We know that we don't always engage with patients who are representative of the patients we serve. We'll develop ways to widen participation in designing services, including seeking involvement from groups typically underrepresented. We'll listen to our patients to ensure that we design care to ensure that access is provided in the right way and use digital tools where appropriate. Deliver as an integrated care system partner. The NHS landscape is changing, and as an acute and community service provider, we need to play our part as an integrated care system partner. Over the coming years, the establishment of the Integrated Commissioning Board, Provider Collaborative Board and the Place-Based Partnership will create the opportunity to deliver improvements for population health. Alongside our partners in Lancashire and South Cumbria, we will participate in clinical and non-clinical transformation work that will support the delivery of safe, effective and sustainable high-quality care. Enhance and integrate community services to support the right care at the right place at the right time. We know from feedback that health and social care needs to be more integrated, making it easier for our patients and their carers to navigate. Integrated care is about giving people the support they need. The care provision needs to be joined up across local councils, the NHS and other partners. This reduces traditional divisions between hospitals and family doctors, physical and mental health, and NHS and council services. In the past, these divisions have meant that too many people experience poorly connected care. As an organisation, together with our partners, we've committed to prioritising the redesign of 4 key pathways of care: frailty, respiratory, urgent and emergency care, medical high care. Over the next 5 years, we will commit to integrating these pathways to improve patient experience and outcomes. Priority 6. Prevention and health promotion. Prioritise prevention and early detection of illnesses in disadvantaged groups. We'll also support patients in developing the skills, confidence and knowledge to manage their own health. Make every contact count, MECC. Making every contact count, MECC, is an approach to behaviour change that uses the millions of day-to-day points of contact that the NHS and people have with other people to encourage changes in behaviour. Its aim is to have a positive effect on the health and well-being of individuals, communities and populations. Our ambition is to train all staff to make every contact count. We'll work with partners to increase the support available for people in our population to manage and improve their own health and well-being. Many long-term conditions are linked to behaviour. By making changes such as stopping smoking, improving diet, increasing physical activity, losing weight and reducing alcohol consumption, people can help people to reduce their risk of poor health. The NHS long-term plan reminds us that every 24 hours the NHS comes into contact with more than 1 million people. This shows the impact of ill health. Actively support patients to improve health outcomes and reduce health inequalities. Health and well-being is determined by a range of factors. Some are social, some economic, and some are environmental. Sometimes, to improve health and well-being, NHS treatment is not the answer. We'll work with our partners to understand the activities available in our local communities to support staff to refer patients onto other services or support groups. For example, social prescribing is a term used to describe how health professionals can refer patients to local, non-clinical services, such as housing, debt support, befriending, exercise or learning groups. Social prescribing supports those who are isolated, experience mental health conditions, or have longer-term health conditions. As a healthcare provider, we'll work more closely with these local non-clinical services and to maximise the opportunities to link up with our partners, patients and local communities. Our population success measures are: train all staff in MECC conversations, increase referrals to social prescribing and lifestyle services, reduce inequality to access for people living in deprived areas, achieve more equal access to services across deprivation groups, achieve more equal outcomes from services across deprivation groups, train all staff in health inequalities, increase use of tools and frameworks to inform improvements. Our responsibility priorities. Priority 7. Get the basics right. Work collaboratively with our partners to improve quality of care and become a CQC Good rated organisation. Strategically align the organisation. For this strategy to be put in place, we will align plans to achieve our aims and objectives, creating a central theme and direction throughout the organisation. Over the next year, we'll establish corporate and divisional plans that will set out the key actions needed to deliver the strategy. We'll also establish an annual planning cycle to refresh these plans. Key strategic plans that we need in place to support delivery include Education, Research and Innovation Plan, Estates Plan, Digital Plan, People Plan, Quality Improvement Plan, Green Plan. Achieve quality standards and accreditations. Blackpool Teaching Hospitals is rated as requires improvement by the CQC, with ratings varying across our different sites. Ongoing action plans are in place to address key concerns raised, and our key objective is to achieve a minimum rating of good in the next 5 years. We'll focus on achieving key quality standards, benchmarks and accreditations by implementing all actions aligned to better births, the Ockenden review into maternity services at Shrewsbury and Telford Hospital NHS Trust, and the continuity of carer model for maternity services, Putting quality accreditations in place across all wards and services, with key action plans to address any concerns. Ensuring getting it right first time, GIRFT plans are in place for all identified specialties and included in regular performance reporting. The organisation will continue to monitor and benchmark itself against national data. In terms of commissioning, we'll work with our provider, Collaborative for Specialised Mental Health, Learning Disability and Autism Services for peer support and reviews to increase service quality across Lancashire and South Cumbria. Deliver the Financial Viability Programme. Future Focus Finance, FFF, is a national programme designed to support staff by engaging everyone in improving NHS financial performance. It aims to recognise NHS organisations that have the best finance skills and development practices in place. At Blackpool Teaching Hospitals, we've been accredited through peer review with a Level 1 FFF accreditation. Over the next 5 years, we'll achieve the highest Level 3 accreditation. As an integrated care system, Lancashire and South Cumbria is challenged financially. We need to work smarter and make better use of digital and partnership working to ensure we're sustainable and fit for the future. We'll reduce our spend by improving how we plan and design our workforce to deliver services with the skills available. We'll also work with partners to reduce duplication, transform and streamline services, and maximise the use of community partners. We'll establish key transformation programmes, working collaboratively within the Lancashire and South Cumbria Provider Collaborative Board and the Fylde Coast Place-Based Partnership Board. Priority 8. New ways of working. Use transformation, digital, innovation and research to deliver new efficient models of care to widen access, enhance health promotion and improve our environmental impact. Enhance our digital and data infrastructure. We'll make our care pathways more streamlined and accessible by investing in digital infrastructure. We'll improve access to information for all, including patients, to improve their experience and outcomes. To make improvements, we'll enhance our digital and data infrastructure by investing in an electronic patient record to enable us to share healthcare information, achieving a minimum level of digital capability and maturity. The NHS long-term plans set out the ambition to reduce face-to-face appointments. We'll embrace technology where appropriate and work with patients and carers to deliver services such as virtual outpatients and wearable technology. We'll offer ways to access health advice quickly by implementing patient-initiated follow-up and offer advice and guidance via primary care providers. Transform and innovate. As part of our strategy development, we'll co-produce a vision for a clinical model and understand what this means to all services we deliver. We'll design and put in place a process to enable population health needs assessments, capacity and demand reviews of all our services, workforce reviews to understand the skill mix we have, vacancies and new workforce models. As part of this work, we'll undertake studies into key services to understand challenges and opportunities. This will support the delivery of our strategy and set out a path to deliver our future clinical model. Maximise the efficient use of estates. We know from feedback that access to our sites can be difficult and that there are many suitable local community facilities available. We will increase our provision in the community, working with our patients and partners. We'll develop community hubs, revise current care pathways, and review how and where care is provided through an estates review, co-producing an updated capital plan. We know that access to our sites can be challenging, and as part of our commitment to reduce health inequalities, we'll work with our Fylde Coast partners to make sure we have the right transport infrastructure to support access to services. Enhance active participation in research. Clinical research is the backbone of healthcare innovation, improving the prevention, detection, diagnosis and treatment of disease to improve patient outcomes and save lives. The treatment and support we provide to our patients will, at some point, have been developed through clinical research. Blackpool Teaching Hospitals is one of 5 National Institute for Health Research (NIHR) patient recruitment centres delivering commercial trials. Each year we run over 100 clinical research studies led by experienced research clinicians, overseen by highly trained research nurses and administrators, and supported by an expert research management and governance team. The organisation is also a member of the NIHR Clinical Research Network Northwest Coast and an NIHR Applied Research Collaboration. Together we work with academics and health and social care providers to help tackle health inequalities by transferring research into practice. Over the next 5 years, we want to make clinical research accessible to all, offer research that addresses health inequalities, enable research through data and digital tools, develop and maintain a supported research workforce, work towards achieving university hospital status, achieve recognition as a UK Centre for Research Excellence. Priority 9. Investing in our community, Anchor. Work collaboratively with our partners and communities to positively impact beyond healthcare. Deliver our Green Plan priorities. The NHS has committed to a target of net zero in less than 25 years. As one of the largest organisations and employers on the Fylde coast, we have a significant environmental impact. This means we have the opportunity to make a positive difference in both carbon emissions and population health. Having a clear path will allow us to focus on and manage our impact on the environment, whilst improving quality and access to services for those who need them. Over the next 5 years, we'll set up the processes and framework to deliver our Green Plan, which aims to achieve net zero by 2040 for our direct emissions, contribute to all the United Nations UN Sustainable Development Goals, achieving a 70% rating in our Sustainable Assessment Tool by 2025. Co-design a local community anchor framework focused on the well-being of our population. Anchor institutions is a term used to describe large public sector organisations, strongly rooted in and connected to their local communities. They can improve health through their influence on local social and economic conditions by adapting the way they employ people, purchase goods and services, use buildings and spaces, reduce environmental impact, and work in partnership with others. Blackpool Teaching Hospitals is an anchor institution, and as such we have the opportunity to positively influence the social, economic and environmental conditions in our community to promote health, wealth and well-being. To do this, we'll co-design an anchor framework to identify how the organisation can generate social value for local communities and staff. Work with our partners across the Fylde coast to identify opportunities to create local wealth and health. Increase our social value creation using a social value framework for measurement. Our responsibility success measures are: reduce expenditure, deliver on quality, efficiency and productivity programme targets, break even by 2025, achieve a CQC inspection rating of good, fully establish accreditation systems in all wards and services, achieve national performance and improvement targets, achieve high performance against national benchmarks, achieve Healthcare Information and Management Systems Level 5. Pay suppliers within 90 days. Achieve Level 3 Future Focus Finance accreditation. Achieve net zero by 2040 for direct emissions. Achieve 70% rating in our Sustainable Assessment Tool by 2025. Increase our social value. Bringing the strategy to life. Stacey Johnson, registered nurse and shortlisted rising star, is an example of how we grow our own. Stacey joined us in 2011 as a healthcare assistant on Ward 10. She really enjoyed her role and working as part of a close-knit and supportive team, but felt she had more to give. Supported by ward manager Lynette Reid and mentored by Tracy Turner and Gareth Burns, Stacey undertook assistant practitioner training from 2015 to 2017. Stacey loved the additional scope and responsibility that this role allowed, being able to cover all duties except medication. When she was recommended for a place on our first nursing apprenticeship cohort, Stacey accepted the opportunity and completed her university studies in December 2021, receiving her professional registration in March 2022. This was a great achievement, not only for Stacey, but also for the organisation's ambition of growing our own, to retain staff, develop talent and help ease staffing pressures. Stacey has spent the whole of her career with Blackpool Teaching Hospitals, working within the respiratory service, and has paid tribute to the brilliant team she works alongside, who have helped her to develop her abilities, skill set and confidence. Commenting, "The Trust has given me massive opportunities to undertake further training and progress in my career. I love my job and come to work happy every day." Our community podiatry initiative, led by George Rogers and Emma Phillips, is an example of prevention and health promotion, and also our aim for a happy and healthy workforce. The Fylde Coast had the highest rate of foot amputations in the UK. In 2016, Blackpool Teaching Hospitals was subsequently awarded transformation funding to tackle this challenging issue. The original plan was to recruit more medics. However, there were already vacancies for medical staff, so the Chief Allied Health Professional suggested an alternative approach, upskilling our podiatry workforce and developing a multidisciplinary team, MDT, in line with the National Institute for Health and Care Guidance. 4 advanced podiatrists were recruited, 2 externally and 2 through internal development. Additional training was provided to all staff, training and additional equipment was purchased. An MDT was developed including consultant diabetologists, vascular and orthopaedic surgeons, microbiologists and radiologists. A clinical pathway was also developed to escalate and step down patients between community and acute settings. This initiative has been highly successful, with data showing a significant reduction in amputations and waiting times from 11 weeks to just 1 week. An unexpected benefit was also an improvement in the cultural climate. For example, in the 2021 National Staff Survey, 100% of respondents agreed that their role makes a difference to patients and service users and feel trusted to do their job. Community Sexual Health Services digitisation is an example of our new ways of working. The pandemic accelerated the need to reach patients in more accessible ways, and the sexual health team responded by introducing 2 key initiatives. 1. Remote sexually transmitted infection screening kits. The team introduced remote testing kits that patients can order online as an alternative to making an appointment at a clinic. This approach has proven to be really popular, with 15,500 self-test kits being processed during 2020-2021 and over 18,500 during 2021-2022 year to date across Lancashire. 2. E-contraception. Sexual health services have undertaken a soft launch of e-contraception, which enables existing patients to order repeat supplies of progesterone-only contraception online, to be delivered to home using tracked mail or collected from a clinic. The process allows the clinical information given by the patient online to be entered directly into their electronic patient records and onto the appointment screen using Blue Prism technology. Benefits of this are that it improves access to contraception, reduces the complexity of the ordering process, and frees up consultations in clinics for new patients or those with more complex needs. Looking forward, the plan is to increase the range of contraception available to request online. A third initiative is also in the pipeline. A digital chatbot function which will be launched on the Sexual Health Service website to enable patients to ask a range of questions about their sexual health and contraceptive needs. Our strategy roadmap. Our strategy sets out ambitious aims for the next 5 years. We'll address our workforce, quality, safety and finance challenges by responding to regulatory action, aligning our strategy to address our biggest risks, meeting national and local expectations. We recognise that most importantly we need to get the basics right to deliver our mission of delivering safe, effective and sustainable care for everyone, every day. Blackpool Teaching Hospitals has developed key actions, plans and work programmes in response to the Care Quality Commission, national policies, operational planning guidance, our challenged provider status, system improvement plan and the trust assurance framework. We've developed a delivery roadmap bringing together these programmes and established the key foundations to enable us to ensure our vision over the next 5 years is delivered. To know that priorities change and every year we will review and revise the strategy roadmap in line with national and local guidance and expectations. Here we outline the detail of our strategy roadmap. The strategy roadmap for our people aim is we will widen access to job opportunities, becoming the employer of choice within our community with an empowered, diverse and engaged workforce through the following priorities. Priority 1, grow our own. Key programmes will be to from 2023 to 2025, develop a schools career programme across the Fylde Coast for primary and secondary schools. Over the next 5 years, develop career pathways from beginner to expert levels across all clinical and non-clinical specialties. Over the next 5 years, develop a talent and succession planning programme to identify future leaders. From 2023 to 2025, develop an incentivised recruitment programme. Over the next 5 years, expand and develop our apprentice and school leaver workforce. From 2023 to 2026, work with local providers to understand opportunities to deliver new subjects and courses. Priority 2. Happy and healthy workforce. Key programmes will be to, over the next 5 years, implement our people plan and the foundation plans on health and well-being. Over the next 5 years, develop and maintain our staff networks. From 2023 onwards, develop an organisation pro-social model. Priority 3. Learning culture. Key programmes will be to, within the next 12 months, implement a board development programme. Within the next 12 months, develop trust values and behavioural framework. Within the next 12 months, expand our teaching hospital educational plan to deliver our strategic vision. Within the next 12 months, implement a triumvirate development programme. Over the next 5 years, train all staff in quality improvement methodologies. Over the next 5 years, develop a refreshed quality improvement programme, focusing on avoidable harm, reducing mortality, and improving the last 1,000 days of life. Every 2 years, respond to key themes from national and local patient surveys and medical engagement surveys. Within the next 12 months, review and improve our freedom to speak up function for all staff groups. The strategy roadmap for our population aim is: we will work with our population to co-produce high-quality services, with a key focus on preventative care and reducing health inequalities through the following priorities. Priority 4. Health inequalities. Key programmes will be to, from now until 2025, capture data to make information available on health inequalities to support action, measure improvement, and provide assurances across the organisation. From now up until 2025, develop approaches to core 20+5 programmes, including participation in the Hypertension Community Connector Model pilot. Over the next 5 years, develop opportunities for typically underrepresented groups to be active participants in service design and improvement. Over the next 5 years, provide accessible information and communication support. From 2023 onwards, provide training on health inequalities and the use of methods such as health equity assessment tools, HEAT, and public sector equality duty, PSED tools. From 2023 onwards, develop an approach to population health based on our understanding of health inequalities in relation to our population, services and staff, and implement with appropriate governance. Priority 5. Integrated care. Key programmes will be to, from now up until 2024, develop a toolbox for co-production for patients, carers, governors, staff and communities. From now up until 2024, deliver Wave 1 and Wave 2 ambitions community diagnostic hubs. Within the next 12 months, refine our directory of community services. Over the next 5 years, contribute to the ambitions of the provider collaborative. From 2023 to 2024, co-produce a child health strategy for our locality. From now up until 2024, deliver integrated care pathways for urgent and emergency care, respiratory, frailty, medical high care. Priority 6. Prevention and health promotion. Key programmes will be to, from 2023 onwards, develop and implement a Making Every Contact Count programme. From 2024 onwards, develop person-centred, interconnected models of care with a focus on prevention and self-care. From now up until 2025, provide proactive support for those on waiting lists to improve health and well-being and prevent harm. Within the next 12 months, develop an elective care patient charter. The strategy roadmap for our responsibility aim is: we will work with partners to deliver high-quality, financially sustainable services and reduce our environmental impact through the following priorities. Priority 7. Get the basics right. Key programmes will be to, over the next 5 years, develop annual strategy plans for divisions and corporate support teams with regular performance reporting. From now up until 2024, make the changes required to deliver the CQC Inspection Action Plan. From now up until 2024, implement all actions aligned to better births, the Ockenden Review and continuity of carer model. Within the next 12 months, develop supporting strategic plans for digital, estates and research and innovation that support the implementation of our strategy. Within the next 12 months, establish an accountability and governance framework. From now up until 2024, establish improvement plans and oversight forums to achieve operational and transformation targets for outpatients. Over the next 5 years, work with teams and services to establish collaborative organisational accreditation system for teams, COAST accreditation. Over the next 5 years, put Getting It Right First Time GIRFT plans in place for all. Identified specialities and include in regular performance reporting. During the next 4 years, develop and implement a medium-term financial plan. Priority 8. New ways of working. Key programs will be to, within the next 12 months, develop a new clinical model. Over the next 5 years, roll out capacity and demand planning across all specialties, in both acute and community settings. Over the next 5 years, ensure all staff who hold a patient caseload have a standardised job plan. From 2023 onwards, review and implement digital solutions to support patients in self-management and access to care. From 2023 onwards, implement an electronic patient record system. From 2023 onwards, deliver a high level of digital capability and maturity. Priority 9. Investing in our community. Key programs will be to, over the next 5 years, deliver the Green Plan priorities. Over the next 5 years, work with our partners across the Fylde Coast to identify opportunities to create local wealth and health. From now up until 2024, co-design an anchor framework to identify how the organisation can generate social value for local communities and staff. Reaching our potential. Blackpool Teaching Hospitals has ambitious plans for the next 5 years, and that will focus on our people. We'll widen access to job opportunities, becoming the employer of choice within our community with an empowered, diverse and engaged workforce. Our population. We'll work with our population to co-produce high-quality services, with a key focus on preventative care and reducing health inequalities. Our responsibility. We will work with partners to deliver high-quality, financially sustainable services and reduce our environmental impact. We know we need to get the basics right first to deliver our mission of delivering safe, effective and sustainable care for everyone, every day. We're making good progress, and we know we can achieve our vision by playing our part to improve the lives of people who live, work and volunteer on the Fylde Coast and beyond.